Welcome to 4 Quarter Lives, a podcast exploring the profound impact of longer, healthier, and more engaged lives, not only for ourselves and our couples, but also for companies and countries. Today, I'm delighted to welcome Debra Whitman, an expert on aging, policy, and longevity from the AARP in the U.S., and the author of the new book, The Next 50, Answers to the 7 Big Questions of Midlife and Beyond. For more than a decade, Deb has been a driving force behind the thought leadership at AARP, one of the most influential organizations shaping the experience of aging in the United States. She's also held key roles in the U.S. government, including at the Social Security Administration and on Capitol Hill, where she's focused on healthcare and aging policy. But this book, The Next 50, is also personal. As she herself approached 50, she realized how much she still didn't know about what lay ahead. She saw a gap in accessible, evidence-based guidance on what aging really looks like today. So she wrote the book she wished she had. The result is a smart, engaging, and highly practical guide structured around 7 fundamental questions about life after 50, from health and finances to work, memory, and how we die. In this conversation, we explore the surprising realities of happiness in later life, the massive disparities in longevity across income, race, and geography, the shifting nature of work and retirement, how longevity and financial security are deeply intertwined, and the importance of mindset and relationships for a longer, happier life. Deb brings a wealth of expertise and refreshingly candid perspectives of the challenges and opportunities of this second half. Whether you're approaching 50, supporting aging parents, or simply curious about what's ahead, this episode offers invaluable insights on how to navigate and embrace the next 50. Let's dive in. Welcome, Debra Whitman, to 4 Quarter Lives. Delighted to have you.
Thanks so much for having me, Avivah.
So, Deb, let's start a little bit with your personal story and how you got to where you are today. You've spent over a decade, I think 13 years, with the AARP. Tell this international audience a little bit, what is the AARP, how you got there, and how you got interested in writing this particular book at this particular time.
Sure. Well, again, thanks for having me today. So AARP is a fairly unique organization in the globe. We are a membership organization, mostly for people age 50 and over, although we have younger members who want to belong as well.
Yeah, I had no idea that you did not have to be 50 to join AARP. I thought AARP was a membership for all Americans over 50, but you were saying it's not. You can join at any age.
You can join at any age. If you want a discount on travel, you can get an AARP card when you're 20. And in fact, we had a huge group of people do that last year. So
you have to be American, I assume.
No, you actually don't even have to be American. So we have members
wide open.
All over. We have a lot of Canadians that, some are in Florida that want the local discounts. We do not have discounts all over the world, and we do not lobby. We as an organization are a membership organization. We provide benefits to our members. We're a communications company. We have the most read magazine in the United States. So we provide information and tools for people on our website. We're an advocacy powerhouse, and we do a lot of research and thought leadership, which is my part of AARP. And I got to this, I'll just say, starting with my origin story, I grew up with my grandmother. My mom was her caregiver for over 50 years. My grandmother had schizophrenia, and she and I had a really close relationship when I was growing up. She'd take care of me, I'd take care of her. And I think that's why I went into aging in the first place. And also just because it's the most interesting time of our lives. Where we are when we're over 50 is based on all of the choices and opportunities we had when we were younger. And so trying to understand the differences and what we can do to make aging easier has been a real focus of my career. So
that's a lovely formulation of defining what I call Q3, the mature adult years, as a sum of everything, all the choices that we have made. That's a powerful statement for many.
Yeah. I have been working on policy issues in the United States for about 25 years. I worked at the Social Security Administration doing research on our retirement programs. I worked on Capitol Hill for about a decade on healthcare as part of the Senate Help Committee. I also ran the Senate Aging Committee for a period of time, and then I've been here at AARP. So I've been looking at a whole range of issues from different perspectives. And one thing, I know you have a global audience. I also lead AARP International work. So we believe that what we do for one, we do for all. And so we really have a mission that's focused on making aging better across the globe. And so we can talk a little bit about that work later if you're interested.
And I've had a couple of your colleagues on lower and middle income countries already. So yeah, we know your international work very, very much and have been promoting it because it's fantastic research. But tell me, let's focus now on, so why this book? Why now? What moved you to, is this your first book? And are you now digesting your own first half for writing about the second 50, the next 50?
So, I've been working on aging for 25 years, and then I was about to hit 50 and realized there was a whole bunch that I didn't know. And I looked on my shelf, and I don't know if you have What to Expect When You're Expecting in the UK, but I feel like every mother of my generation has one of those. My kids were getting ready for college, and so I had tons of books about that stage of their life. But there really wasn't anything out there that sort of looked at all of the things that happen to us as we age. And so I literally wrote down the questions that I had, and those became the chapters of the book. And I'll just say, Avivah, even though I'd worked on these issues for a long time, there was a lot I didn't know, and I talked to experts, and I talked to people across the country. I did surveys and focus groups and dug into the research on so many topics that I wasn't an expert in, and just even asked some provocative questions that I was struggling with. So that's how the book came to be. And had I known how hard it was to write a book, maybe I wouldn't have started the project. But
it always feels better once it's done and out there, like a baby, right? Kids are hard too.
It does. And I also wanted to write this in a way that my mom could read it. Somebody in their 20s thinking about their parents could read it. Somebody in their 50s could read it and find certain chapters more interesting. Somebody in their 80s could read it and find other chapters more relevant to their daily lives. So it's not supposed to be a technical manual. It's supposed to be sort of a conversation piece.
And you've really succeeded. I mean, I think that's what I really appreciate about the book is how accessible, simple it is, and the structure of these 7 questions is absolutely brilliant. So share with us maybe what are some of the questions, and what were maybe your favorite questions or the ones you found most impactful with audiences you're now engaging with after you've written it?
So the questions are, some basic questions. How long will I live? Like, what is it a 50-year life expectancy after age 50 or not? And how does that differ across the population? Will I be healthy? Because we know that matters a great deal to our quality of life. I looked at practical questions that you are engaged with a lot. How long will I work? Will I have enough money? And then I asked some tough questions like, will I lose my memory, and how will I die? And I'll say the ones
I think it's just fantastic. There's just the simplicity of that structure so resonates with really the majority of people's not always very deep understanding of these issues, but those are the questions they're asking themselves.
Yeah, those are the gut check questions. I think there's 100 others that could be added, but those were some of the basics. I found questions like, how will I die, fascinating because I have not spent as much time thinking about that in my life, and had questions like, what's it like to be with somebody when they're dying, that I couldn't really find a lot of information about. So I interviewed a palliative care nurse.
People don't like to talk too much about that whole dimension. It's something that's a little bit still taboo in many of our cultures now.
It is, but in our surveys, people, particularly as they age, want to talk about it.
Yeah.
They are seeing their friends and family. It also spurred really great conversations with my own family when I started asking them. I asked my mom, what kind of funeral would you like? And at first she's like, oh, well, whatever you put together. And I said, no, we would really like to know what you want so we can, honor your wishes. And then she had a whole list. She actually wanted 2 funerals in 2 different places. And that was really helpful information. And we wouldn't have had that conversation if I projected that she would be uncomfortable. She was fine. She thought I would be uncomfortable. So yeah, there's some taboo topics, but actually talking about them can really help families a lot.
Here in the UK, I'm sure that we've just gone through a big debate on assisted dying, which has been voted through its first round for the first time after many, many years in so many countries. Populations who want it, but politicians who resist it. So
I touched a little on that, but also really looked at the arguments from the disability community that are worried, whether their life will be seen with as much value. And so tried to balance that difficult debate.
So tell me a little bit, the title itself of the book, I think, is also significant. The Next 50. I think that's a lovely, subtle, and fundamental shift on how we think about longevity. How did you pick that title? And is it because you turned 50 and that's your new projection?
I think I was trying not to use aging in the title. And also trying to give people a sense of time. So many people, and again, because we're an organization that sends you to sign up for membership at age 50 and people act with all kinds of drama, that's the end of their life. I wanted to point out that no, it's really just this start of a new phase, and take some of the ageism and take some of the judgment about what happens in your second 50 off, and just have people appreciate this expansion of time that we've seen with increasing life expectancy.
You're boldly pushing towards the 100-year life that we've seen some times like that.
Andrew Scott already took that title.
Yeah. So. But I thought the Next 50 was a very nice one. There's an organization here in the UK called Noon for women over 50. And I think it's a lovely idea that basically you're saying we're only halfway through, which I think is a good reminder to many who are feeling a little old or aging by the time they hit 50. So a lot of this book is about reframing. Reframing aging, reframing longevity, using a bit of a new vocabulary, simplifying some of the language and concepts. And you're arguing that the second half isn't just an extension of the first, it's an entirely new and different chapter. Share a bit. What are some of the sort of optimistic sides of the tale you're telling?
First is we think of aging as a time of all decline and despair when people are twice as happy in their 70s and 80s as they are in their 40s, according to a survey that we did. And so many people don't realize, the good parts of getting older.
Why are they happier? So what's if we dig under that, why? What's going on? Are we just really, really unhappy in our 30s and 40s?
I think that's a piece of it. And I think, we asked people, 8 out of 10 people in their 70s and 80s have a chronic health condition, right? And then we asked them, are you healthy? And they said, yes, I am. And so I think your expectations about perfection and what your life is going to be soften as you age. You say, instead of saying what health is perfection, I'm as healthy as I can be with this body right now, and I'm not going to be upset about it. Even people with low financial assets, we ask them, are you financially okay? And many of them will say, I'm getting by. They've learned how to live on the budgets that they have. And so I think mindsets change as we age. And we also appreciate the things that we do have. We appreciate our family, friends, other connections in different ways. So I think that's a piece of it.
So you've talked a bit about aging and economic stability. So longevity and inequality are intimately tied in the U.S. as much or perhaps more than in many countries. What's the range that we're looking at in terms of that interconnection? The gap is enormous.
It's huge. It's huge. since I'm talking to an international audience, it's embarrassing how bad it is in the United States. So if you go to the longest lived county, Summit County, Colorado, if you've ever heard of Breckenridge, it's a beautiful ski resort, they live 20 years longer than in Lakota County in South Dakota, which is home of the Pine Ridge Reservation. 20 years of it. You can drive between the two in a day. And, we see these differences within cities, even just across different parts of the city. We see huge racial and ethnic differences. So I mentioned Oglala, Lakota County, the average Native American in the United States only lives to 65. The average Asian American lives over 80. And then we have huge differences by income and education. So the top 1% of wealth, men and women in the top 1% of wealth live over a decade longer than the men and women in the bottom 1% of wealth. Even if we compare US, in some of our areas, has life expectancy of Sudan. But even if we compare the best of our folks, the richest Americans don't live as long as the richest Americans in other comparable countries like in Europe. So there's something structurally wrong in the United States to have these disparities. And we do know that policies can make a huge difference. So differences between states can be explained by things like tobacco taxes, minimum wages, access to healthcare, all of those types of things that can help improve the health of the population. So there's a lot that we could be doing here in the US if we wanted to have life expectancy and more importantly, healthy life expectancy as a goal.
Yeah, because life expectancy, the U.S. now has this strange record of being about the only country left on the planet where life expectancy is falling unexpectedly, whereas everyone else continues.
It was falling before the pandemic, to be clear, too. It's not just because of the pandemic. So,
and people don't understand that. So what's the cause of this? Why is the U.S. branching off? It's not COVID, and we're seeing the post kind of COVID stats beginning to emerge. How do we explain it?
Some researchers, notably Ann Case and Angus Deaton, showed the deaths of despair, so rising rates of suicide and deaths to things like opioids. I just saw some data this morning. Our rates of diabetes, particularly in middle age, are twice that of comparable countries, same with heart disease and others. Even our death rates at younger ages in the teenage to 20s are much higher from things like suicide or motor vehicle accidents. And so there's not just one cause, right, but it's across the lifespan, particularly in the middle ages areas. Some of the data pre-pandemic was particularly among men. I haven't seen enough post-pandemic data to say that, but there's a variety of reasons. And, our obesity rates are much higher than other countries as well. Our healthcare outcomes, even though we spend twice as much as you do, are way, way worse. So lots of things to be done.
A long list of multifactorial terrors. Okay. And there's a lot of push. Now the push in Europe is certainly to try and shift these rather heavy healthcare systems we have, national healthcare systems, away from treating the sick to much more preventive medicine. I imagine that's something that you're recommending, seeing in the U.S. What's the trend?
Absolutely. We do have more of a focus on disease care than wellness care in this country, and more focus on hospitalization rather than prevention. So the ways to do that are more complicated with a diverse healthcare system that we have. So you have national, your healthcare system is integrated. So the investments are of, investing in community health can be borne by the government itself that's making those investments. It's a little bit more tricky here, where if you invest in, say, better access to good food, that one entity that can actually benefit from that through lower healthcare costs is across multiple health insurers and multiple programs. And it's a little trickier here to have the cause and effect, but we certainly need to be shifting our systems in that direction.
So let's move to a related issue. One is the question of how long will I work? And that depends, of course, a lot on how healthy one is. We know that everywhere. But it's also just you've written a lot about how do we shift people's expectation of how long they stay active in the workplace. And do you believe in the end of retirement or its serious shifting forward?
So certainly the data is showing, at least in the US, that twice as many people at older ages are working than they did in just the 1990s. And I think that's for a couple reasons. I think one is people are living longer. They like their jobs. It provides a sense of meaning and purpose. If you have a job like mine and yours, probably, you can physically do that into older ages. We have a second trend, which isn't quite as glamorous. And that is there's a lot of people that are working because they can't financially survive in retirement without having that extra income. We, unlike you, don't have a universal retirement program. An employer can decide to offer you health insurance. They can decide to also offer you a retirement plan or not. And so in the United States, half of workers are not covered and able to save through their paycheck, which we know is the easiest way to do it. And so, that means that half of people, when they go to retirement, really haven't had those opportunities and have very low balances, if any, depending on the job histories that they had. For them, they just have Social Security, which averages in the US about $22,000, which really isn't enough to live on in most parts of the country. And so work is, it can be that fun thing that you do. And there's a lot of people that are rediscovering different types of careers that they want. And then there's also the people whose bodies are tired and who are desperately looking for jobs and have to continue to do them, whether they want to or not, into old age because they just need the money.
Yeah, because I read another book by some Harvard people, I can't remember, that said already, like in the UK, actually, there's a whole bunch of people already in their 50s who can't keep working for health reasons. Not working in your 50s, the likelihood of you working in your 60s falls very dramatically, and this challenge of keeping people working is
probably Lisa Berkman's book on overtime. Right. Yeah. So in the US, half of people lose their job involuntarily in their 50s due to a health reasons, or they're pushed out through their employer or caregiving need. And so if you lose half, and only 10% of those that lose their job in their 50s ever make what they did before. Your salary goes down.
That's sobering statistics.
It's hugely sobering. And if you lose your job after 50, it takes you much, much longer to find a new one. So we do have this, midlife precariousness that most people don't plan for. So you may be planning to work until your late 60s or 70s, and then you lose your job in your 50s, and you're suddenly, struggling to maintain labor market attachment.
So I'm just curious, you're in touch with all your members, and especially the younger ones. What's their reaction when you tell them, they're going to have to keep working into their 70s and, they better get on the wagon and start upskilling regularly? Do they see that as a huge burden, or does it depend on their age and stage?
I think there's a huge cultural difference. And I was talking, you and I were at the OECD meetings a couple of weeks ago, and I was talking to one of my panelists from Japan, where the tradition is that you want to work, right? That people want to find jobs. And I was
unlike the French who are marching in the streets.
Well, I was sitting next to somebody from France who, we want to have time to drink wine and hang out with our friends. There's no one answer to your question is what I'm saying, Avivah. It is not just very cultural, it's also very personal. And it depends on what else you need to do with your time. We haven't talked about it yet, but there's a caregiving crisis at the same time where, the people over age 85 are more likely to need some help. And because, at least in my country, we don't have a long-term care system that's part of our healthcare system, the family usually has to step in. And so, we're seeing more and more people in their 50s and 60s and 70s have to leave their jobs in order to take care of somebody else in their family. So there's a variety of things that they want or need to do besides work. and maybe your own health, and you need care as well. So, but younger people today don't want to work forever. They want to work less and enjoy life more. And, maybe the promises of technology will bring us that future. But we also need to think about the benefits of having a multi-generational workforce. And I know this is something you work a lot on. Having people of multiple generations working together is what employees want. So we've been doing a lot of the conference we were at. I was doing a lot of work with the OECD to show first, do people want to work with other generations? Yes, all over the world they do. What about teams? Are they more effective if they're multi-generational? Yes, the research from OECD shows that multi-generational teams are actually more effective and productive. And then are people getting the training they need across their life course? And unfortunately, that answer has been no. People are less likely to be offered it in order to maintain their skills. So I think there's still a mismatch between what we need as a society. We need to keep workers engaged in order to keep growing our labor forces, but we also need to invest in them.
Yes, big words, big policy implications for all. So let's move on to how do we keep them working and how do we keep them financially well as physically well. So the whole issue of financial security and wealth spans is another major question in your book. Will I have enough money? What is enough money? And are people planning? Are people planning younger? Are we getting through to people? And when do you have to start worrying about this stuff? When you're 20, or can you catch up when you're 50?
The power of compound interest says you should start young and put a little aside. I'm lucky. My husband was a teacher, made very little, but he always, contributed the maximum to his retirement account. And that has grown from his, first job in his 20s. And we're actually seeing younger generations.
I've tried to inculcate that into my kids. Compound interest, compound interest, compound interest.
Well, and we're actually seeing millennials have more savings than generations previous to them at the same ages. So a piece of it is this work to try and increase access to savings. And one of the things that I've been really proud of and that AARP has been working on is we've got 20 states to set up retirement systems for employees that employers doesn't offer them a plan. Again, we don't have universal, so now we're having to pass state by state laws. That will help a lot because, sort of setting it and forgetting it and having it in an account makes a huge difference to people's futures. I think you asked how much do people need, and that's the big unknown because it depends on how long you're going to live, and it depends on will you be healthy, and it depends on will you lose your memory. Because again, I'm using all U.S. examples. My apologies to your listeners, but because we do not have a long-term care system, families have to pay out of pocket. The average cost of a nursing home here is about $70,000. If you need memory care, it can be double that. I have friends that are paying over $200,000 a year for memory care for a loved one. And one of them told me that didn't include incontinence care. So $200,000 a year still didn't keep their loved one dry. And so, those kind of expenses means you can work your whole life and save a ton and you will just run through all kinds of money. And it hits families when, somebody breaks their hip and all of a sudden needs a lot of care. And that's when many people realize that we don't have a system of long-term care. So I sort of raise in the book, will I have enough money? And it's all of our stools for retirement, be it the retirement savings system that we just talked about, our pension system. Very few people in the United States still have pensions if you're not part of a union or a government, state and local government worker. And then Social Security in the United States is going to have a fiscal imbalance by 2035. And so, we have a lot of anxiety here in this country about people's financial security, especially when I talk about these huge costs that could hit you if your health gets to the point where you actually need more than just a doctor's appointment, but you need somebody to help you in your home.
What do you think about all this? I was just at an insurance industry conference yesterday talking about how the insurance industry is going to be one of the big players in trying to pick up the financial pieces. When you see the stats of the second billion people over 60 rising in all kinds of countries, many of whom don't have any kind of pension systems, what do you think? Are we just going to go into yet another kind of set of polycrises, or is there a way through innovation of financial mechanisms that we haven't dreamt up yet?
I haven't seen a financial innovation that's going to completely outweigh it. But let me just say this.
Is it just going to implode? We're just going to have all
listen, I've been working on this for 25 years. We knew the baby boom was coming. We knew it was coming. And if we 25 years ago, when I first started, had put a few little things in place, the problems we are going to face in the future would be far less. So a big part is ignoring demographic change doesn't make it go away. It just makes the problems.
What did we miss? What were the three things we should have done?
Minor tweaks to our Social Security program could have made it solvent for the next couple generations. Minor things we could have done 25 years ago. A long-term care system. So insurance is the financial thing because, as I said, none of us know whether we're going to need a lot of care, need a little care, or need no care. And if we each as individuals try to save for several years of dementia care, that's on a basic salary is almost impossible. But if we can pull some of the insurance pieces of it, becomes a lot easier. So foresight, planning ahead, all of those things really matter. The longer we wait, and similarly, we're seeing labor market shrink. Are we investing in our workplace systems, our job training, our hiring? Are we pushing back against age discrimination so that people who want to get a job can find one? All of those things need to be in place now. Ideally, they could have been in place 20 years ago. But that's a little bit of why I wrote the book, too. I'll just tell you, yes, I wanted to answer the questions myself, but I've also been screaming about these issues for years. And I wanted other people to understand there are holes that we're going to be falling into in our second 50 that we could fix today, and we need to.
Yep. What's been the reception? What are you hearing as you start touring with this book?
The best feedback I get is when people find some piece of it of interest to them, or they take a personal action. My wife and I sat down and we're working on our wills. We signed up for an exercise program because we saw that was a key point of healthy aging. And so those are the parts that are exciting to me. Or I read the book and it really helps me talk to my mom. And again, the conversations I had with my parents about the book, again, it covers a lot of different stages, as you know, happen within that second 50. So, people are finding little pieces that might be relevant to them. And that makes me happy.
With all that you've now researched and the stage where you are in your life, if you could offer just one piece of advice to somebody approaching 50, not yet hitting it, what would you pick and prioritize?
I'm going to take it a little beyond one piece if you'll indulge me. One of the things is how much we know about how we can live longer and healthier. And probably people wouldn't be surprised about the types of healthy habits that will make you live longer. So you eat right, you exercise, you don't smoke, you don't drink too much, and you maintain a healthy body weight. You can live about a decade longer and also healthier. But what people don't realize is how important our mindset and our relationships are. So our mindset really matters. If you view aging as a time of meaning and purpose and wisdom, you live 7.5 years longer. 7.5 years. That's amazing. You can exercise every day and not live 7.5 longer. But if you think positively, and it's not just living longer, you have lower risks of cardiovascular disease and all kinds of other things. The second was I interviewed Bob Waldinger, who wrote the book Good Life. And he has done...
That's the Harvard study, is that right?
It's the Harvard study of adult development.
8-year-long Harvard study that's been going on since 1929 or something.
Yeah, so he looked at the people in their 80s. And because they had surveys of them back when they were 50s, he said, okay, well, what's the difference between the healthy 80-year-olds and the unhealthy 80-year-olds? And the key thing he found wasn't cholesterol. It wasn't exercise. It was who had good relationships. And so our relationships also really matter to our health and longevity. And so Those two things I'm going to take with me. I already have a positive view on aging. I'm surrounded by vibrant 90-year-olds and 80-year-olds in my day job, but I'm investing a little bit more into my relationships and friendships and realizing how important that is, not just for today, but also for the future.
Deb Whitman, we will close on a message of love and relationships. I think that's exactly where we're all heading these days. Thank you so much for your time, for your input, and this great book. It's a wonderful addition to all of our next 50s.
Avivah, great to see you again. Thanks for having me.
See you soon. For more thinking about the impact of our 4-quarter lives, you can read my column at Forbes and subscribe to my Elderberries newsletter on Substack. Let's design lives that aren't just longer, but better.